What's going on, everybody? We are here. I'm here with Dr. Koi. Had a little bit of rough start with this technical difficulties, but that's how it happens. But we are here because I ran into Dr. Koi. First, we were introduced to one another by Tatiana Green. She was on the show talking about her financial fitness and her journey to debt free. So, and number one goal, student loans. So she's been knocking that out, but she introduced us. And now we're here with Dr. Koi, and he has some amazing things to share with us because I saw him on Instagram through one of his testimonies from his clients of getting better through type 2 diabetes. So I have him on here because I don't think type 2 diabetes just alone for the elderly. It is for those who are 38 like me, and and I'm sure he has a lot to share. So, welcome to the show, sir.
I appreciate it. Thank you so much. Thank you so much.
Yeah, and so if you give us a quick shout out of your Instagram handle.
Yeah, so it's Koi Wellness Solutions.
Okay.
Everything. So on Instagram, Facebook, of course, but Koi like the fish, Wellness Solutions.
There we go. And you're gonna see him on there working out too. Doing all type of crazy things and staying in shape. So you know what he's talking about. So we're gonna get some tips. And Dr. Carr, I just want to start out by saying thank you for coming on the show.
Yeah.
And I know this will benefit a lot of people, and hopefully people will tune in and share it with what they have. Also, you can follow us on the Dangling Carrot or Dangling_Carrot Podcast on Instagram. Also, you can like us, go on YouTube. Make sure you hit the notifications button and subscribe. But let's get started. First and foremost, how did you get started into the health and wellness business?
Oh man, this goes back to me being in high school, just running track and playing football, but then I also ran track collegiately. And, my parents have always been into health and wellness and the medical background. So I try to follow their footsteps, of course. And so my bachelor's is in exercise sports science from East Carolina University. Shout out to the Pirates.
But, okay, see right here. Okay.
Yeah. So, and from there, my quest has always been to help people as much as possible through health and wellness, and so I enjoyed it. I felt that was a calling for me.
Mm-hmm.
But throughout my career, I just love learning. I love helping people, find ways of helping people as much as possible. So obviously that just graduated to getting my master's degree in exercise sports science, but then eventually got my doctorate. And of course, just branching off into starting our wellness company as well.
Nice. That's nice. I didn't know that you started out are you from North Carolina?
Yeah, I grew up in Charlotte, North Carolina. We're from Sierra Leone, West Africa, but grew up in Charlotte, East Carolina University, and even my master's degree is in Spartanburg, South Carolina. So I'm a Carolinian in heart and heart, but now we're in South Florida right now.
Nice. And now you said something that your parents were into fitness as well. How did that impact you?
More so, I always look at that, they've been in the medical field, and seeing them, from my mom branching from being a CNA to nursing, and my dad, being a medical technologist and phlebotomy, and just seeing how he branched off. But he eventually became a minister. So I'm a late PK. So there's some wellness in that as well. So seeing that growing up as well.
Wow. So you said a lobotomist.
Phlebotomist.
Okay, I'm about to say wow. The stories he could tell you. Okay. There. I'm glad I got it. I'm glad I got it straight.
Yeah.
And so with the health and wellness, you said starting in high school, you ran track, you played football, and I feel like all of us in high school, for the most part, we're in shape. Metabolism is high. We're burning every day in gym and weight training and on the field. But how did it take hold after? Because my wife and I were thinking about this last night, that after high school, your running goes down, the things that you used to do, your metabolism slows down, and so how do you keep that going, or was there any struggles from high school into adulthood?
Oh, of course. I mean, we all, we get into adulthood, and time
Mm-hmm.
is of the essence. We start families, we have work
Mm-hmm.
commitments, we have, all different types of things going on within our lives. And, one of the things I just find is that it comes down to prioritizing, what's important to you in everything that you do. Um,
Mm-hmm.
and I think that, whatever you put your eyes on, whatever you focus on grows, whether it's
Yeah.
positive or going the opposite way, negative. And, obviously, for people, you have to prioritize it. You have to make sure that, you become a leader of your own health and wellness. And that branches off to why we have our company, where we're
Mm.
helping individuals and companies, employers, to help their employees to become healthier, because there's larger things at stake
Yeah.
as a result of just pushing things to the side and ignoring health disparities that affect people these days.
Mm. So, what would you say to that parent that they're hustling and bustling, and they get into point A to point Z, and they have to do it within a fast time, and maybe they have to stop at McDonald's real quick and grab a Happy Meal, and in the course of that, they're taking a couple of fries themselves.
Mhm.
What would you say to a busy parent that feel like they don't have a lot of time to break off and go to the gym, or to do things, or to commit like that?
Well, I think that you have to start with something. You have to start small.
Mm.
Don't try to to bite off more than you can chew. First, you have to define what your ultimate goal is, and how you want to progress in life, and how you want even leading your own family. Again, it comes back down to health disparities and things of that
Mm.
nature. You can't ignore them. The statistics show that we die of heart disease at a heavy clip. And
Mm.
when we recognize these things, it comes down to, we have a heart problem,
Mm.
literally
Yep.
and figuratively. Uh,
Mm-hmm.
and recognizing that, you know, you have to pay attention to these things, and every little bit counts.
Mm.
So moving in a positive direction is starting small. It may be that instead of eating out at McDonald's 3-4 times a week, just bring it down to once a week. If that means
Mm.
that, hey, you don't have a whole lot of time, but hey, you can get out for a walk and do 5-10 minutes of little exercise, do that. Because the odds are that if you move in that direction, you're going to get better. You're going to continue to progress if you have that strong mind, and also have that ultimate goal of keeping yourself healthy as well as your family.
Yeah, and most people work in the workplace where they sitting often. And
Yes.
what would you? And we'll get into the nitty gritty and what you really do, because I really want to talk about that.
Hmm.
But just for some tips, because I'm 38, right,
Yep.
and we think that a lot of the stuff may avoid us because we think we're still young.
Hmm.
But can you give us anything on that? Like, what do you say for people who are my age, 38, and feel like I still got my whole life ahead of me? I'm still young. What are some warnings for us?
Yeah. So some, I would say, again, coming back to, what are your ultimate goals? Sitting down and really discussing that with either professional
Yeah.
or just even with your own family. How is it that you want to continue to lead your life? And what are the things that, obviously, there's family history issues that come about we can't ignore. There's obvious time constraints
Hmm.
of that nature. So, you have to define those clear lines in the sand, and make sure that you're moving in that right direction. So again, if you're sitting down for days upon days, for as a job, we see that with um, we're more sedentary.
Mm.
We lay down to sleep. We sit down for breakfast, lunch, and dinner, and then we go back down and sit down for our work job, for our
Yeah.
work occupations and things of that nature. And so, even if it's just getting up and getting out,
Mm.
statistics show that a person that can walk 10,000 steps a day, they're able to decrease their health disparities by,
Wow.
so just getting more steps in. But, choosing things that you enjoy, look at things that you enjoy, that things that you can be able to sustain and be consistent at. That's the most, being consistent. And one of the mantras that we always talk about is that it's better to be consistently good versus occasionally perfect.
That's
Nobody's
good.
perfect.
Right.
But you can be consistently good though at something, and that requires just dedication and commitment.
And so, looking at your Instagram as you're doing a lot of these workouts that you do, I'm telling you, I'll go check it out, man. So he's doing what he's talking about. How did you? Would you take that model and that's how you got there? Just consistency, and then occasionally just kind of progressed into the things that you do now. I mean, how often do you work out? What are some things? Let's say if you can't make it to the gym, what are some things that you do in between?
I mean, I'm just like anyone else. I'm an entrepreneur. I have a practice. I'm very busy, and I have to get out, even if it's all right. I have 10, 15 minutes. I know I'm not going to be able to get a full hour in or whatever. Hey, I have that 10, 15 minutes. Let me get that done. It may be a walk. It may be stretching. It may be just going for a quick jog or just doing some core work. Something that just keeps the ball rolling.
Yeah.
And that's the key there. It's rather to be consistently good than occasionally perfect. I know it's not going to be a perfect day. I know it's not going to be a perfect opportunity for me to sit in the gym for hours upon hours, which I would love to do, but I can't. And most people can't either. But the key to it is just continue to put your health as a top priority. And when you do that, things start to come in place. And also having your why. Like what is your why to what you're doing what you're doing?
Yeah.
Very easy for us to put that why for our jobs and our occupations and things of that nature because we have to earn a paycheck and take care of our families or take care of responsibilities. But then when we come back to essentially, what is my health purpose for? What am I really looking to do with my health? We say we want to be healthy, but how do we go about doing that and the why? It may be because, hey, I want to be around for my kids. I want to be around for my grandkids. I want to be around for this nonprofit organization that I'm part of, or my church, or whatever that you're part of. You want to be the best at it. When you're doing, and that may require for you to, make sure that your health is in the right place so that you can serve the community around you.
Wow. And that's big because a lot of ministers, given myself and others that I know, really don't think about that and think about how much they could be used if they're a little bit more healthier. And being able to handle the task or to focus. And I think that gets overlooked in the church because it's church, it has more to do with the Lord than my body.
Yeah.
And so, what would you speak to those? Because you said your parents was a minister, so you're a late PK. And I know you've seen, plenty of chicken dinners. You've seen plenty of banquets and revivals where they want to feed the pastor. What would you say to that pastor that everywhere that he or she goes, they're trying to feed them?
I mean, it's very close to me because my father passed away because of issues with his health. And I find this to be very troubling amongst our caregivers. These are my nurses. These are my teachers. These are my social workers. These are, my doctors. These are my ministers. Those and parents, loving parents and people that take care of other people. If you're in that category of caregiver, you typically have the same personality. Like, you're willing to do anything and everything for someone else.
Yeah.
You're willing to put in the hours. You're willing to give up a lot in order to see someone else succeed. But many times on the other side of that coin, it can become very detrimental to your own health because you're not looking at yourself as a conduit, as a servant that you need to make sure that you're at your best. And when we find these things to come about, we have to people start neglecting the most obvious and most prized possession that you have, and that is your health. That is your wellness.
Yeah.
And paying attention to that is very, very key, because I find that most of my caregivers are the worst at taking care of themselves.
Yeah.
And yes, I'm giving, and they're givers, and we have to change that mindset, because oftentimes you become a burden on someone else, because again, this is a heart problem.
Yeah.
Physically, mentally, emotionally, spiritually, this is a heart problem. When we see this coming about, the consequence that we see is that we have heart disease, and we have the complications to diabetes, stroke, metabolic syndrome, all these factors that come about, but we don't think all the way back to, well, how am I taking care of myself? I'm taking care of my flock. I'm taking care of the people, my patients. I'm taking care of my kids, my husband, my wife, or whoever that you find yourself taking care of. But who's taking care of you? And we have to take responsibility for that. We have to look at that. We have to look at that a little bit more strategically, because the consequences of that, where I'm seeing, individuals like yourself, the 38-year-olds, my 40-year-olds that are being diagnosed with type 2 diabetes, and statistically showing that's the worst age group to be diagnosed with a complication like that.
Wow.
When we see that, and we see younger individuals, even now we're seeing in our kids that they're being diagnosed with these complications and these disease processes that are very preventable, yet chronic at the same time. It leads down to the road of destruction. And so, we have to be smarter, and look at this and not ignore it, that we have all the time in the world. We have to look at that a lot better than what we.
Man, that is so good. I never looked at it that way. We're all caregivers, and that one common goal: do for everyone else except for us. And I find that very common, because I can go to a game, go supporting a team, going to a particular service. I got a lock in coming up later in April, where we're going to be up all night, and so but then trying to find time for myself, in which I'm trying to do. My wife's trying to keep me accountable in that. But trying to take care of yourself in any small way. Now let's get to what you do, and you brought this up a lot in type 2 diabetes. How did you get in that field, as far as really dealing with that, and what keeps you focused with dealing with it?
Well, I mean, of course, with my background, just coming up in the ranks of, being a personal trainer, being a having to deal with people with cardiac rehab, going through that, even dealing with people that we see come into the office due to musculoskeletal issues, with back pain and neck pains and all these things. And so, one of the common things that I just remember seeing is that you just hear type 2 diabetes a lot. You hear that all the time. And that just really, it was a ringing gong in my head, and obviously coming up and saying, you know what, this is a common thread here that needs to be looked at, to the point where we know statistically that there are 39 million type 2 diabetics walking around in the United States. That's, if you go to your local mall and walk around, for every 10 people that you see, one of them will be a type 2 diabetic.
Wow.
Out of 10. So if you even go to your church, in the crowd, and you just count, you'll see 1 out of 10, and 1 out of 5 does not know that they're a type 2 diabetic. The statistics do not lie. And when you see this, and you see how this is being brought on like it is a you problem, you didn't diet enough, you didn't exercise enough, where you need to change your diet, and you need to be more active. And if you understand that this is not just a weight problem, this is not just you're not good enough problem, This is a metabolic condition. This is a systemic, chronic, degenerative disease
Wow.
that plagues us all. And in certain communities, it hits them harder than others. And then when we see this going on, we need to understand that this is not a you problem. Yes, we need to be responsible for, what we eat. And yes, we need to be, have a active lifestyle. But this doesn't just, you can't just bracket this as a you problem. This is a metabolic condition, and this is a degenerative disease that there are numerous root causes as to why a person is a type 2 diabetic. And there's so many myths and misinformation that's out there. And some of it is because we're sincerely ignorant to the situation, but many times we're also conscientiously stupid to the situation. And our goal is to just release the truth about this, that it is reversible. And these conditions, these metabolic syndromes, these things that people go through are reversible. And you don't have to be subjected to just medication for the rest of your life, which gives you some complications and risks and slows down complications, but it does not correct the total problem. We need to understand those aspects of this disease.
Yeah, I think I'm on the sincerely ignorant side. And I'm thinking that, because of what you ate constantly and continue to put in your body, that type 2 diabetes came upon you. But what are some examples? Because you did say something interesting. You said 1 in 5 don't even know they have it. So how can I identify that I do, number one, have it? And what if it's not just my eating, if it's not just, the person not being good enough or not exercising, then what are one of the ways that can also come upon them?
Yeah, I mean, the best way to get, well, let me just say this, there are close to 100 million that are pre-diabetic. And so the way you know that is through a blood panel, and you get your A1C done, and most people will go to their doctor and get some blood work done, and they may check their A1C, hemoglobin A1C, and that is a marker that shows the amount of glucose that's in your bloodstream. So if there's an uncontrolled level of your glucose, then obviously, depending on which category you'll be in, whether pre-diabetes or diabetic, the doctor will tell you about that. And so that's the best way to know. In regard to with our practice, our number one goal is to find or help individuals find the root cause of the diabetes. And that's totally different than just being diagnosed. The diagnosis can be done just by blood work. And typically diabetics, when they go get their blood work done, or they go in for a health insurance policy, they're just getting a checkup with their job or what have you, they get the call and they're told that, hey, you're a type 2 diabetic. Well, after that is typically medication. Whether it's a cascade or algorithm of medications based on your history and things of that nature, you'll get prescribed. And that gets you going on that traditional medical model cycle. And it's there for a reason. It's there to help you, to stop you from having the complications that you can end up in the ER or have a complication. But the other side of this is that, you have to understand that there are triggers. There are numerous reasons why a person could be a diabetic. And the key here is that you have to understand that just like any other problem that you may have in life, you can put a Band-Aid on it, or you can actually address the real problem. And sometimes in some individuals, being that you don't know, or again, you have that sincere ignorance to the situation, sometimes it could be a gunshot wound that you're trying to put a Band-Aid on. And type 2 diabetes is a symptom, or is a flag that lets you know that the body's not balanced. The key to my practice is that we have to understand that these things exist, and we have to understand that there is a root issue to it. It could be environmental. It could be something going on with you that you really don't know that is driving your glucose to be so high. That also causes you to have numerous complication risks like heart attack, stroke, neuropathy, on the verge of having amputations and things that we don't like to talk about, but I love talking about it because it lets us know that these things exist. And okay, now what do I do about it? Or what can I do to prevent myself from getting to that end stage?
Wow, that's heavy. That's heavy. You mentioned one thing, neuropathy,
Yeah.
and I'm just now really being introduced to that and hearing about it. Can you briefly tell us just what neuropathy is?
Well, neuropathy is a disorder where the nerves are not conducting very well. We
Okay.
have nerves, the nervous system, our brain, our spinal cord, our nerves. It's our connection to our environment. It helps us to with sensory, to feel, touch, smell, all these things that we know and love. But it's also to make sure we have function as well, motor function. And our nervous system is there to give us feedback, to be able to function, to be able to perform the things that we need to do.
Right.
And when those nerves are not getting its nourishment, or when we have uncontrolled blood sugar levels, this is a complication where the nerves are actually dying from the tips up. And
Wow.
so we get the numbness, we get the tingling, we get, individuals that have difficulty walking because they feel like they're standing on pins and needles,
Yeah.
or they have fine motor skills that are being diminished because they have that lack of sensation.
Yeah.
And so these are factors that with type 2 diabetics, when you feel these things going on, even can go into with individuals with pre-diabetes. These are metabolic syndromes, that a class of syndromes that affect us. And this is a symptom that many people may not feel, or they may think that it's, just because I slept on my arm wrong.
Yeah.
They just know that it's something that is transient. But, these are signs, these are symptoms that are letting our innate wisdom know that, hey, something's not right, something's imbalanced. And when you find those things, you can't ignore them. They're flags to let you know that, hey, there's something deeper going on and it needs to be investigated.
Wow. Okay. Thank you for that. And listen, everybody, again, we're on here with Dr. Koi and giving us a wealth of information within a small time frame. We're going to have you back because I believe that this is information that, again, we don't talk about, nor does anyone want to talk about, especially in the Black community. Anything about being sick or going to the doctor. A lot of times we dismiss it, wipe it away, like you said. Oh, I slept wrong, or maybe it's just heartburn, or just different things of that nature, and just write it off. But as we close, because this guy's, as you heard, he's an entrepreneur. He has his own practice. He probably needs to go work out in a few minutes, so we need to give him that time. But what would you say to those, again, that are young like me, and feel like we can eat whatever we want? How can we better take care of ourselves and be more conscious at the age we are now to prevent, the diseases that comes in our 40s and our 50s?
Yeah, I mean, it comes back to one of the quotes that that I try to live by. Is that's by Dr. Martin Luther King Jr. He said that the two most dangerous people on the planet is one person with conscientious stupidity and another person with sincere ignorance. I kind of butchered the quote, but you get what I'm saying. Is that we can't ignore these issues. We can't ignore them, and these health disparities that we thought that were old people things that be in the 60s, in the 70s, 80s, and I don't have to worry about these things. Oh man, it's coming down, and we see this going all the way down into our children. And it's one thing to be sincerely ignorant to it, and this is why these podcasts, with you, I really appreciate you, giving this platform to spread the word and give this opportunity for individuals to say, let me think about this and let me contemplate it. Let's see if I do need to make a change. But then, okay, what are you going to do about it? What are the things that need to take place? And it is important for you to, if you value your health and value your family, value the people that you serve in the community, you have to look at yourself. You have to take responsibility for yourself and be a leader, be an intentional leader for yourself in order to move you in the best way, but also to lead a legacy and to leave something behind that is that's long lasting, and that's obviously with the health that you leave behind with individuals as well.
Yeah, absolutely. Well, thank you, Dr. Koi, for this information. Again, y'all, go ahead and follow. Give that IG tag one more time.
Yeah, so it's Koi Wellness Solutions. Again, Koi, like the fish, Wellness Solutions on all platforms.
All right, Koi Wellness Solutions. Go and check them out. Go follow them.
Yes.
Do you have anything else that is coming up that we need to know about?
Well, we do free webinars on Zoom, very often. So if you're looking to improve your health and also reverse type 2 diabetes, I'm giving free webinars all the time there. So just go to our website, go to our Instagram page. We'll be able to point you in the right direction on the dates that we have those webinars throughout this year.
Absolutely. So go follow them. And again, don't forget to follow Dangling_Carrot on IG, and also find us on YouTube. Subscribe, hit that notification. But this is just one of many. Next time we're probably going to do a little bit more extensive, and possibly, and your wife is a doctor as well, correct?
Yes, my better and smarter half. She.
Oh man! So listen, we may have to get them on here, y'all. Together, so we can do a part 2. But thank you again for giving your time, and we really appreciate it.
I appreciate you. Thank you so much.